Hello, my name is Dr. Robert Joseph, and I'm a member and fellow of the American College of Foot and Ankle Surgeons. If you're a runner, chances are you are no stranger to aches and pains. In fact, for most runners, that's par for the course. But what you should do if your pain is more than just a fleeting problem, how do you know when it's time to seek help? First, let's look at some of the most common running injuries. Many runners develop heel pain, and the most common form of this is a condition called plantar fasciitis. Other injuries runners commonly get are shin splints, stress fractures, and tendonitis. Of these four injuries, plantar fasciitis is the easiest to recognize because its symptoms are heel pain. However, other three injuries can be tough for runners to differentiate because they can also produce pain in similar areas. For example, shin splints are often used as a generic term by athletes, coaches, and others to describe pain in the lower leg. You might hear that you can just run through a shin splint and take ibuprofen or Tylenol for the pain. But in reality, that pain might indicate something more serious, like a stress fracture, which requires its own treatment. A stress fracture is a hairline break in the bone. Many runners are prone to getting stress fractures in the shin bone, which is called the tibia, and the bones of the foot as well. Pain at the site of a break and sometimes swelling are the symptoms of stress fractures. Tendonitis, which is an inflammation of a tendon, also produces pain, and sometimes swelling in the lower leg or elsewhere. Tendonitis associated with running can occur in any of several tendons that extend from the lower leg into the foot. As you can see, it's often not easy to figure out the why of your foot's aches and pains and why your lower leg hurts. So what should you do? You can start by taking some simple steps that may help. First, give your injury a rest by cutting back on the mileage or schedule for a little while. You can also ice the affected area. Take ibuprofen or another anti-inflammatory drug that change your shoes or if they're worn out. Some injuries will resolve themselves by taking these measures, but that's not certainly always the case. If your pain continues, it's time to see a foot and ankle specialist. Be sure you don't wait too long to get the proper diagnosis and treatment started. In evaluating your pain, the foot and ankle surgeon will carefully consider when and where you have the pain and will examine your foot and leg. Sometimes x-rays or other imaging tests are needed. Once the surgeon identifies the source of your pain and arrives at a diagnosis, you can begin treatment. And you can also learn how to avoid future injuries. In addition to resting the injured leg and foot, your treatment might include stretching, strengthening exercises, physical therapy modalities, orthotic devices, over-the-counter shoe inserts, and sometimes shoe modifications. In some cases, you may need a cast or a walking boot and crutches. Just as important, your foot and ankle specialist can identify any training errors that might be putting you at risk for these or other injuries. This can be invaluable in helping you prevent or reduce future problems. For more information about injuries common to runners and to find a foot and ankle surgeon near you, visit foothealthfacts.org, the patient education website of the American College of Foot and Ankle Surgeons.